If you've got acid reflux or GERD and you want a safe and natural solution for it, then this video is for you. Right now, I'm going to explain the difference between acid reflux and GERD and tell you what you can do about it drug-free. And my solutions are all based on evidence-based natural medicine proven by science. Hi, everyone. I'm Dr. Krystosik, and today we're tackling a very common problem, acid reflux and its relative GERD. You might know it as heartburn, that burning sensation after a meal, sometimes with a sour taste in your throat. It may seem like a minor nuisance, but if it happens often, it can turn into a more serious health concern known as GERD, gastric esophageal reflux disease. So in this video, I'm going to explain what acid reflux is, what GERD is, and when they happen, what symptoms you're to watch for, and most effective natural ways to get relief. So what is acid reflux? Well, it occurs when stomach acid moves backwards into your esophagus. That's the tube carrying food down your mouth into your stomach. See, normally a small muscle called the lower esophageal sphincter, it acts like a valve, opening to let food in and closing tight after you experience eating the food. It's supposed to close up. But when this valve weakens or it relaxes too often, acid escapes and it goes upward, irritating your throat and your chest. And that's what causes the classic burning sensation. And if it happens more frequently, more than several times per week, or even daily, it's diagnosed as GERD. Symptoms of acid reflux is heartburn. That's the most common symptom, but it's not the only one. Acid reflux can also cause a sour or bitter taste in your mouth, difficulty swallowing, a chronic cough or a hoarse voice, and a chest discomfort, especially at night. It can even cause dental erosion of your teeth, since acid can damage tooth enamel. And if left untreated, reflux can inflame your esophagus and in rare cases can increase the risk for cancer. And that's why it's important not to ignore the recurring symptoms you might have. Well, why does acid reflux happen? Well, there's several factors that can set the stage for reflux. Let's look at the most common causes. The first one is large meals. Overeating puts pressure on the stomach, pushing acid upward. Now, there are some trigger foods. Overdoing the following foods like spicy foods or fried foods or coffee or alcohol and chocolate. Those are the big offenders. Now, excess weight. That's another one, especially extra weight around the belly. That increases the pressure on the stomach. Another one is hiatal hernia. That's a condition where part of the stomach pushes upward into the chest, weaken the protective barrier. Lying down after meals is not a good idea. You see, gravity normally keeps the food down, but reclining after a meal soon makes the acid reflux worse. Stress. Now, is that a surprise? Well, not really, because it causes a lot of problems. Now, stress, it doesn't directly cause acid reflux, but stress increases acid production and tightens the muscles, weakening the muscles and causes the symptoms. Now, how to fix the acid reflux naturally? Now, that's what you're looking for. The good news is that most cases, it can improve with natural, practical steps. The first thing is eat small meals. Don't overeat. That's going to be one of the keys. My rule of thumb is to eat up to about when you're 80% full. Eating smaller meals puts less pressure on your stomach, and that means less acid reflux. Then track your trigger foods. Keep a food journal. If heartburn follows after having coffee or fried foods or chocolate or wine, definitely avoid them. Everyone's triggers are different, and I encourage you also to get a food allergy sensitivity test. That's going to be important, and oftentimes it's going to be an immediate allergy test because that can cause acid reflux, especially quickly after meals when you see symptoms. And then avoiding lying down right after eating. Giving your stomach at least 2 to 3 hours before you recline or you go to sleep. And then also you can elevate your head and your chest at night, raising the head of your bed so that your head and your chest are about 6 to 8 inches higher than the lower part of your body, can prevent acid from traveling upward. And then managing your weight. Even losing just 5 to 10 pounds can take pressure off your stomach and reduce symptoms. Try natural remedies. like DGL licorice. That's deglycerized licorice. You know, the licorice root has over 300 natural compounds that help to decrease inflammation and lower the symptoms of acid reflux. And in 2017, the Australian Journal of Traditional Medicine found that deglycerized licorice, DGL licorice, was able to help to reduce the symptoms of acid reflux better than the acid reflux medications over a 2-year period. And then also using things like aloe vera gel. That's a really good remedy. It's been used for thousands of years. Taking a couple tablespoons before meals with some water a couple times a day can make a huge difference. And then some people find that apple cider vinegar and water may help balance stomach acid before meals. Taking probiotics and eating probiotic foods can help to balance the bacteria in your gut. And then, of course, reducing stress by doing deep breathing and prayer and meditation can calm the digestive system. But you need to seek medical attention. And if natural approaches aren't working, then I would suggest getting to a physician that practices functional medicine and trying to use natural remedies before turning to the drugs, which may sometimes be necessary, especially when you have a frequent reflux and you've got difficulty swallowing and especially unexplained weight loss or chest pain. You need to see a natural doctor right away so you can get some help. Ongoing reflux can cause esophagitis, ulcers, or precancerous changes if ignored. Medications, short-term or long-term, and over-the-counter acid and H2 blockers or protein pump inhibitors provide quick relief, but they don't solve the root cause and they can have many different side effects. Long-term, especially uses of the PPI drugs, those are proton pump inhibitors, may lead to nutrient deficiencies, cause wasting of your bone loss, and changes in the gut bacteria as well. That's why I always recommend focusing on lifestyle and dietary changes first and natural remedies before using the medications that are really oftentimes unnecessary. But get some professional guidance if the acid reflux is prolonged. Now, my final thoughts. Here's the big picture. Acid reflux happens when the stomach valve weakens and acid flows back into your esophagus. Symptoms can be mild at first, but harmful if ignored, it can turn into GERD. The solution, well, it isn't just popping a pill. It's how to eat properly, how much you eat, and how to take care of your body and use natural remedies. And not eating such big meals, avoiding trigger foods, keeping your weight in check, and making a few natural adjustments and taking some natural remedies that are safe and get some long-term relief. Your body's designed to heal itself. You need to give it the right foods and the right environment. Well, thanks for watching. I'm Dr. Krystosik, and if you found this video helpful, I would suggest that you would tell friends about it, subscribe to our channel, and join our Gut 911 prescription community. It's absolutely free. Check out the link below. And again, I encourage you to take care of yourself, learn the natural way to good health, and live an independently healthy life. Until next time, ciao for now.